In vitro fertilization, or IVF, is among the most innovative and groundbreaking advancements in reproductive medicine. IVF provides infertile couples with hope and a chance at motherhood that would otherwise be impossible. Despite the excitement and hope that IVF inspires, it is important to recognize that treatment is not always successful. Unfortunately, the journey of many optimistic parents ends in a failed IVF. Each unsuccessful effort may cause an agonizing emotional roller coaster, and today we will discuss the causes of an IVF failure and what to do about it. Genetic abnormalities in embryos are considered to be the most common causes of IVF failure. Such abnormalities may stop the embryo from growing normally, which might result in unsuccessful implantation or a premature miscarriage. Genetic problems can result from problems in the egg or sperm or both. Advanced techniques like PGTA are used to detect abnormalities in chromosomes before transferring the embryos, improving the likelihood of choosing healthy ones. Endometriosis is another cause of IVF failure. IVF success and fertility may be affected by inflammation and scarring caused by endometriosis. Endometriosis patients usually have a diminished ovarian reserve, poor quality eggs, and a greater chance of unsuccessful implantation. Sometimes, laparoscopic excision of endometriotic tissue may be advantageous for certain patients and increase their chances of success with IVF. Unsuccessful IVF might occur as a result of abnormalities in the uterus, such as fibroids, uterine septum, or polyps. To increase the success rates of IVF, surgical procedures or hysteroscopy may be required to rectify these problems. Sometimes the uterine lining might be too thin, which can make it difficult for embryos to effectively implant. For this, prolonged estrogen supplementation and strategic timing of embryo transfer may be helpful. There are advanced scientific techniques like ERA, which helps in finding the correct timing of implantation, which improves IVF results. Failed IVF can also be due to advanced maternal age, because as women age, they produce less healthy eggs, which increases the possibility of unsuccessful fertilization or abnormal embryo development. Many times, the responsiveness of the endometrial lining may provide difficulties for elderly women. Egg donors can be suggested in certain cases in order to increase the likelihood of being pregnant successfully. Male infertility issues can also be one of the causes of IVF failure. Fertilization can be hampered by low sperm count, sluggish sperm motion, or defective sperm morphology. This can be addressed by advanced andrology techniques such as ICSI, IMSI, or MACS. The results of IVF might be negatively impacted by lifestyle decisions like smoking, alcohol, or obesity. These factors may impair the quality of the egg and sperm and result in an unsuccessful IVF. Increased mental anxiety can also affect the hormonal milieu in a woman's body. Apart from this, exposure to environmental chemicals and pollution can lower the quality of eggs and sperm, and that affects the IVF results. Improper administration of medicines, low progesterone supplementation might also result in early miscarriage. Thyroid abnormalities, infections of reproductive tract, or immunological problems may also lead to IVF failure in some cases. For patients with suspected immunological problems, immune modulating therapies such as intralipid treatment or immunosuppressive drugs may be taken into consideration. Another condition causing IVF failure is hydrosalpinx, in which the fallopian tubes are filled with infected fluid. Such tubes may prevent implantation of embryos due to leakage of toxic materials into the uterus. Surgical removal or clipping of these tubes may enhance IVF results. There are many causes of IVF failure, and it is critical to properly deal with each one through a customized strategy. So have a detailed discussion with your doctor to find the cause of your IVF failure and do the remedial actions. Thank you.